Greetings, my name is Dr. Chris Bird. I'm here to speak to you on behalf of the Coastal Bend COVID-19 Pandemic Task Force. It's May 1st, 2021, and we're going to give you the weekly report. So the task force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. We're going to do something a little different this week, and we're going to start with the summary. So if you don't want to watch the whole presentation, you can see the summary and then decide if you want to watch further. First, new cases are slightly increasing, and those increases in cases are mainly being driven by people under the age of 17 in the Coastal Bend, as well as people in NUECES. Second, hospitalizations are increasing in the Coastal Bend. These increases are being primarily driven by increases in COVID patients in the ICU. Third, fatalities are approximately level to slightly decreasing, and the projection indicates that the present level of fatalities will continue, which is between 1 and 2 people per day in the Coastal Bend are dying from COVID-19. I want to remind you that if we rely only on vaccinations to slow down COVID-19 transmission right now, there can be another outbreak. We do this by modeling and projecting what could happen if all of the things that we're doing to stop the transmission of COVID-19 stop, other than the vaccinations that are taking place. And lastly, because of that, you're encouraged to stay vigilant, get vaccinated if you can, especially if you're between the ages of 16 and 49. This demographic and our population, while eligible to be vaccinated, is vaccinated at a much lower rate than people above the age 50 and above. And remember that just because you yourself might not be at a high risk of having severe COVID symptoms doesn't mean that somebody you love doesn't, or that things can't change with the evolution of another variant. So make sure that you continue to wear your face coverings when out in public and social distance as much as you can, because this isn't over yet. And I'll remind you that the CDC's new recommendations are that people that are vaccinated and outside don't have to wear their face masks. But if you're not vaccinated, then you're still, the CDC is still saying that you need to wear your face masks outside. So there's good reason to get vaccinated. Okay, so back to the presentation as it normally progresses. There's several interventions taking place. Number 1, get vaccinated. 2, avoid crowds if you can. There's more likely to be COVID in crowds than in areas where there's less people. Again, face coverings and social distancing are encouraged when you're inside or if you're not vaccinated. Isolate when you're exposed or symptomatic. And there's partial to all remote schooling taking place as the school year winds down here. I want to remind everybody that according to the risk dashboard at nuecesknows.com, which tracks 6 different indicators of COVID transmission risk, that there's a high risk of encountering COVID out in the community right now. So you're encouraged to do all these things to try to prevent the spread of COVID. Okay, there have been 43,033 total confirmed cases of COVID in the Coastal Bend since the beginning of the pandemic. There have been many more actual cases, but these are the confirmed cases where somebody either got diagnosed by a physician or they tested positive with the PCR test, where they have to send that off to a laboratory. It's not the rapid test. Of those 43,033 cases, there have been 41,118 recoveries. The thing that we're really focused on, or the category we're really focused on, is the number of active cases. These are active confirmed cases. It's at 774 right now, and that's a 24% increase in active cases over the past week. It's been several weeks to months since we've seen an increase like this in active cases. On the figure or on the graph here, it doesn't look like that big of an increase because of how high we've been in terms of active cases active cases at any one time, being up to maybe 7,500 in the past and last summer. But we do see an increase over last week. Right, and this is obviously going to be reflected in the transmission rate. So the transmission rate is on average how many people that catch COVID pass it on to somebody else. And so, or how many additional people get infected. So for every person that gets COVID, about 1.02 additional people get infected. What that means is that for every 100 people that get COVID, they pass it on to about 102 people in aggregate. So that means that COVID is slightly increasing, which matches some of the data I've shown you so far. And you'll see as we go through the rest of the presentation that there's been an increase in the number of cases in the past week. That being said, if we stay at the same level of vigilance and we keep doing the same things to prevent the spread of COVID, then the transmission rate will decline. If more people get vaccinated, it will decline further. But this should have already been happening. I want to remind you that if we had kept doing the same things that we were doing to stop the spread of COVID on top of getting vaccinated, this line would have plummeted. And back in January to the beginning of February, we were down near about 0.6. So COVID was really in decline. Since then, we've leveled off. So when we're right around 1, it means COVID's staying right at about the same level. And lastly, if you're wondering how do we come up with this value of 1.02, well, here is a image of the calibration plot that we use. The black dots are the actual weekly number of new cases. So each dot represents the past 7 days worth of new cases. And then the orange dots are the simulated weekly number of new cases. We adjust the pandemic parameters such as transmission rate to the point where we get a really good fit between the two data sets. So that's how the model is calibrated, by the number of new cases. And so the number of new cases is up slightly this week. While it's very difficult to see in this plot, we'll show you additional plots that demonstrate this. And so it looks like the projection is level. It's approximately level, but it is slightly increasing. So there's the projection now indicates that if we stay where we are, that will increase through June very slightly, essentially staying at the same level before coming back down again. So as you know, these things can change. If the trend continues of increasing cases, then the projection will change also. But this is the projection given that we stay where we're at now. Okay, when we start breaking this down, what's contributing to there being a rise in cases? Well, it's primarily that between the ages of 18 and 64, the number of new cases is staying about the same. And for people between 0 and 17 years old, the number of new cases is increasing. And so we're seeing more people, more young people, and more kids in our community are contracting COVID, testing positive for COVID. And there's two reasons that we're seeing the trends that we are. The reason why other age groups aren't increasing as much is at least partially due to vaccinations. And people below the age of 16 cannot be vaccinated right now. But there's another component here that's happening, and that's that these new variants, especially the B117 variant, has increased virulence. What that translates into is if you got a little bit sick on the old variant when you had COVID, you get more sick if you were infected with the new variant. And so before, children were likely to be asymptomatic if they contracted COVID, and they're very unlikely to show up as a confirmed case. But now that we have these new, more virulent variants, that means that more children are symptomatic when they contract COVID, and that's contributing to this rise. Okay, when we break down the number of new cases by county, you can see there's been a marked increase in NUECES over the past week, and this increase is approximately 50% in NUECES County. Now, you remember the number of active cases increased by 24%, so I mean, that's really being driven across the whole coastal bend by NUECES County and to a lesser extent Jim Wells. Other counties that are rating on the chart here, Clayburgh is slightly down over the past week versus Duval and Aransas are slightly up over the past week, and San Patricio is down. When we zoom out to the South Texas area, I can see that I forgot to update this graphic here, but there's a continued decrease in McAllen and San Patricio, and then it's level in places like NUECES, where we are now, to slightly increasing, and then Victoria and Brownsville and San Antonio and Laredo, they're increasing the most. So we have a mixed pattern here, not just continued decrease, that's only for McAllen, Aransas, and San Patricio, but we also have places that are increasing in South Texas. Again, I forgot to update this, this text graphic there, so there is a decrease in Amarillo, and then a level pattern in Houston, Austin, and increasing patterns in Longview, Dallas, South Texas, El Paso, and San Antonio. Now, overall, the level of cases is low compared to where we were in the winter. So, but it is either staying level or turning upwards, and what we'd like to see is these all go downwards. I guess we had some wishful thinking with this message. Okay, so this is not a misprint here. We've got an increase in the number of COVID inpatients in the hospitals over the past week, and you can see it's pretty definitive, and it's breaking outside of our projection. I can't really say what's causing this difference right now explicitly. It doesn't really track with the number of confirmed cases right now, so we're going to watch this closely and see what's happening, and we're going to dig into this a little bit deeper here. So let's go to MedSurg. So a MedSurg bed is medical slash surgical. It means a general admission bed, and you can see here that the general admissions for COVID are approximately level. There's not a really big increase in the past 2 days, a little bit of an increase, but not outside of the variability that we're used to seeing. Now, when you look at people in the ICU with COVID, there has been a marked increase over the past week, and this is the thing that's driving that increase in the number of COVID inpatients overall. So we'll go to our normal ICU plot that we show, where there are now, at last count on April 29th, 29 COVID inpatients in the ICU, and you can see that's a pretty big increase over the previous week. Not quite 50%, but almost a 50% increase in the number of COVID patients in the ICU. There's still plenty of capacity, though, for people without COVID in the ICU, and a total of 169 people in the ICU in the Coastal Bend on April 29th. When we look across all the ICUs in each trauma service area, this is the same plot right here that I showed on the last slide, but now we're showing all the other plots around the state. You can see a trend where it's mostly level, but there's a couple trauma service areas, Longview, Tyler, Paris, where there are increases. Corpus Christi, Victoria. And so if you want to inspect this a little bit more closely, I encourage you to pause the video. Moving on to our graphic that indicates the amount of stress that COVID is applying to the ICUs of Texas. Right now, the amount of stress looks pretty low. Blue means less stress, red means more stress. So as you see, more red, and this is just essentially the proportion of patients in the ICU that are COVID positive. You can see that mainly the ICU patients across the state don't have COVID right now. There has been an increase in Victoria, like we said, in Corpus Christi, and some of those other locations that I pointed out on the last slide. Moving on to fatalities, the projection has the fatalities being approximately level. I will point out the projection, the model fit is a little bit low here. It means that we're underestimating the fatality rate relative to how many people contract COVID. That's possibly due to the variants that are more transmissive and a little bit more virulent. But we're not that far off. There's between 1 and 2 people each day in the coastal bend that die from COVID-19, and the projection indicates that we expect that to continue to happen out into the future. If you find this unacceptable, then there are things that you can do. Try to do more things to stop the spread of COVID. If you on your own wear your mask, if you double up, if you have a surgical mask, double that up with a cotton mask, you'll help to stop the spread of COVID, and you'll help decrease this fatality rate in the coastal bend for people with COVID-19. All right, so we've had an increase in the total number of fatalities. Obviously, I think there's about 10 this week, and 9 of them were in Nueces County. So we're up to 1,270 fatalities in the coastal bend. And I want to remind you that this data comes from the state of Texas, where they independently count every death certificate and identify whether the primary cause of death was COVID-19. Those are the numbers that we're showing here. All right, on to more positive news. The number of people, or the proportion of the population that's fully vaccinated, ranges between 19% in Live Oak and about 37% or so in Kennedy. See, Nueces County is at about 28% of the population being fully vaccinated. And I want to emphasize again, we're not talking about just adults. We're talking about what proportion of the whole population was vaccinated, because that's what affects herd immunity. So as you can see, we've got quite a ways to go with only 28% in Nueces or 29% in the whole coastal bend. A trend has continued here where other trauma service areas, we are the coastal bend trauma service area, but the border here, this is El Paso, this is Austin, this is Laredo, and this is the lower Rio Grande Valley, along with Brownsville and McAllen. They've all pretty much outpaced us at this point with their vaccination percentage being above 30%. We've slowed down a lot. We've only gone up 2% over the past week. I want to encourage you again, if you're eligible to be vaccinated, you should get vaccinated. The time is now. I know the public health director, Annette Rodriguez, said that if you haven't been vaccinated yet, they'll be there at Buck Days, and you can get vaccinated at Buck Days, and in exchange, they'll give you free admission. So that's a nice deal. You can also go to La Palmera Mall, where Charming Charlie's used to be. You can get vaccinated there. And if you're wondering other places where you can get vaccinated, I suggest you either call your doctor. My doctor gave me a call last week and asked if I wanted to get vaccinated, and I let them know that I had already been vaccinated, but thanked them for calling me. Maybe your doctor's giving out vaccinations. And you can also go to cctexas.com to find other information on places to get vaccinated. Right, what does the trend look like in vaccinations? We're hearing all these news stories that it's leveling off, and I'm not saying that those are false, but if you plot a line through the number of people that were fully vaccinated from February 1st through the present, there's an approximately linear increase in the number of people fully vaccinated. You can see lately it's a little bit different trend, but it's not abnormal to see deviations from this line. So we'll just have to see out into the future. But right now, we don't see a huge pattern of leveling off in the number of people that are fully vaccinated. What we do see a little bit more strongly is a leveling off in the number of people with at least one dose. And this is probably being caused by two things. First, is that maybe there's some proportion of people, I think the public health director said maybe about 5% of the people that get their first dose don't get their second dose. The other thing is that now that more people have gotten their first dose, we might actually be seeing a leveling off in the number of people that are eligible to get vaccinated, going out and seeking that vaccination and following through on it. So those are the trends. If we break this down by age group, I know we're really concerned about vaccinating our most vulnerable, and one way of identifying the most vulnerable is by age. And so as you get older, you're more vulnerable to severe effects of COVID-19. There's been about 70% of people over 80 years old that have been vaccinated fully. I'm sorry, have had at least one dose. Over 75% of those 65 to 79 have had at least one dose, and we're in the 60% approximately for people that have had at least one dose above the age of 50 up to 64. From there, there's a precipitous drop down to somewhere around 30% of the population 16 to 49 having been vaccinated. And then obviously if you're below the age of 16, you're not eligible to be vaccinated right now. I want to encourage you, especially if you're in this age group between 60 and 49, what are you waiting for? Go out there, get vaccinated. It's not a big deal. And then if you're out in public, in the outdoors, the CDC says it's okay not to wear your mask, and you get a little bit more convenient time out there at the park or when you're going to buck days. Okay, last thing, we've retapped into our source of cell phone metric data, so we've brought this back. And what you can see is that from spring break, there's been a decline in non-essential visits and distance traveled and a decline in encounters. So how have we stayed level in terms of transmission rate, in terms of new cases, or even increases now in hospitalizations and slight increases in new cases? How have we managed to stay level despite the fact that for the past month and a half, we've been declining in terms of these other metrics that indicate how likely transmission is to occur? And it's really pretty easy to explain. It's people taking their masks off. There's no doubt about it that that is one of the primary things now that's driving the continued trend of COVID. So if you don't like COVID, if you want the pandemic to end and you're tired of it, the best way to make that happen, besides doing some of these other things, is to wear your mask when you do go out in public. Remember, NUECESknows.com risk dashboard indicates that there's still a high risk of encountering COVID when out in public. Okay, we did this. We started with a summary, so I'm not going to do it again. That's the pandemic report for this week. We welcome your questions and feedback on Facebook, Twitter, and Instagram. Our handle is @CBCovid, Coastal Bend COVID, CBCovid. It's easy to look us up, drop us a line. We'll address your questions on Fridays. We are planning now to move towards a schedule where we deliver the public reports every other week, given that there's a fair bit of stability now in the level of COVID. If things change, we'll go back to delivering the pandemic report every week. But this is going to go for both the pandemic report as well as for answering your questions and comments on Facebook on Facebook Live. We do that on Fridays at noon. Now we're going to do it every other Friday at noon, unless things change substantially here. Now, this doesn't mean that the pandemic is over. I just showed you a lot of different figures that show, if anything, it's picking up a little bit of steam right now, although it's not really launching. And so it's staying approximately level with the exception of hospitalizations. So anyway, if there are updates that we think you need to know about, we will put those out on social media. And I think that you'll rest easy knowing that the task force itself will continue to meet weekly and discuss the latest trends in COVID-19. And even though you might not see this report every week, the COVID task force will. So I want to thank you very much for tuning in. I hope you have a great, safe weekend. And remember, if you're at Buck Days and you haven't been vaccinated, make sure you wear your mask. All right, we'll see you in 2 weeks.